Dr. T. And today I'd like to talk to you a little bit about the various chiropractic therapies and treatments available for your health problems. First of all, I'd like to tell you a little story about my background and some of the people I've treated over my 30 years in practice. My very good friend John Russell, who I grew up with and known for years. John went on to train Jerry Page, who was an Olympic champion in boxing. He trained hundreds of fighters since I've known him. He went on to train Buster Douglas, the heavyweight champion of the world. Again, my background consists of I've always been in athletics, always have been into nutrition, and that's why I chose to be a chiropractor. Chiropractor is a natural form of healing, so we believe in nutrition, we believe in exercise, we believe in a healthy lifestyle. Personally, I've had a few Golden Glove fights when I was growing up. In 1970, I was runner-up in Akron in the Golden Gloves in the heavyweight division, as well as 1972. I went on to work with fighters who were training for the pre-Olympics. I also have worked with the karate championships on a national level with the athletes. I've worked with my friend John Russell, with Jerry Page, Olympic champion, gold medalist. I've also treated Buster Douglas, heavyweight champion of the world. Buster, I watched train prior to him fighting Mike Tyson in Japan, and I was amazed at the condition Buster was in. It was just amazing. He was getting up early in the morning, running 6 miles. Following that, he'd go to the gym and work out for a couple hours, weightlifting, riding a bicycle. Then he would go to the gym about 4 o'clock. He would do calisthenics. He would do 5 rounds in a speed bag. He would do 5 rounds skipping rope. He did another 5 rounds in the heavy bag. 5 rounds shadow boxing. And he finished up with about 8 rounds of sparring. And as I watched him train, I thought, this guy is in amazing shape. After that, he went out and did sprints. I was amazed. So it was no quirk that Buster Douglas beat Mike Tyson in Japan. But getting back to my story about who needs chiropractic. Everybody can benefit from chiropractic. Children can benefit. Everybody has a spine. Adults can benefit. It's just not professional athletes that can benefit from chiropractic care. Everybody needs chiropractic care. What I would like to do today is to talk to you about the various therapies that chiropractors use and their benefits. First off, when you come into our office, we're going to do an examination. Then we're going to probably recommend x-rays. Once we review the x-rays with you and we determine the cause of your problem that's causing your symptoms, we're going to recommend a treatment plan. Sometimes we'll use our hands to adjust the spine to try and correct those misalignments. We also have an apparatus called the Pulse Star, which is a very gentle apparatus. You put that on your neck and back, and it has a palpating apparatus that mobilizes that spine. Very gentle and very safe. Works very good with auto accidents, workers' comp injuries. Works good with people that have arthritis, elderly people. Works good for everybody. We also do diversified techniques. All our doctors in our office are highly trained. They all have chiropractic degrees and are physicians. Most of us have had at least 8 years of college. The education we receive are out of the same medical books as a medical doctor. The only difference is our approach to health care is a natural approach without the use of drugs and surgery. So first of all, if you have a misalignment of the spine and that's causing your symptoms, we're going to use the apparatus I discussed before, very high tech, safe and gentle. We also may use some diversified movements with our hand. From there, we have massage therapists, licensed, highly trained, to work with you. The procedures they use are called myofascial release, in which they're using manual traction and different procedures in order to help relax those muscles. Again, the techniques and procedures our massage therapists use who are licensed are safe and gentle. In addition to that, we have a apparatus, we call it TheraStem. It conducts a current. So we apply it if you have a neck problem, we may put it on your neck. While you're having that procedure done, you should be stretching. It's geared to do several things. Number one, it gets rid of pain. Number two, it'll reduce muscle spasms and inflammation. Number three, it'll help increase your range of motion. In addition to that, we have licensed nurses, licensed massage therapists, and licensed chiropractic physicians who render and recommend various therapeutic rehab exercises for you. Generally, we start with stretching exercises, progress into strengthening exercises. We work on balance, and we work on core exercises, in addition to recommending endurance exercise. So when you first come in our office, we generally do the manipulation using the Pulsar apparatus, which is gentle and safe. We may do some massage, myofascial release work with licensed massage therapists, and we will recommend various exercises, stretching, strengthening core, and balance exercises for you to improve your condition. Therefore, the treatments we use in our office are natural, safe, and oftentimes I ask the patient, kind of a funny note here, can you tell me what we're doing to you in the office? Because we have various doctors in our office, and sometimes I like to know what the doctor's doing to you. So the patient will say, well, the doctor comes over and he uses the jackhammer on me. And of course, he's talking about that gentle, safe apparatus that's a Pulsar that we put on your spine and try and mobilize the spine. But the patients call it a jackhammer. Then the patient will say, and then they put me over there on the shock me. I'm going, shock you? And they go, yeah. And again, we're putting them on the TheraStem. Again, a very gentle frequency that helps relax the muscles, helps get rid of pain, helps improve your range of motion. And then they say, well, then the massage therapist rub me down. And again, they're using advanced procedures in order to release fixations, reduce muscle spasms, relieve pain, and improve your range of motion. So it's kind of funny to get the interpretation of what a patient thinks we're doing to them. But the bottom line is we're getting results for patients. And we're doing it naturally. So try chiropractic. Chiropractic works. Chiropractic's safe. And chiropractic gets excellent results.